clinical vignette questions, one for each gram-negative Coccobacillus listed. Each includes clinical case, 5 answer choices, correct answer with explanation, rationale for incorrect options, treatment highlights. Had 1 Haemophilus influenzae, encapsulated type B. A 2-year-old unvaccinated child presents with high fever, drooling, and difficulty breathing. He is sitting upright with his neck extended and jaw thrust forward. On exam, stridor is present. Lateral neck x-ray shows a thumbprint sign. What is the most likely cause of this child's condition? Corynebacterium diphtheria, B. Haemophilus influenzae type B, C. Parainfluenza virus, D. Streptococcus pneumoniae, E. Epstein-Barr virus, B. Haemophilus influenzae type B. Explanation: classic presentation of epiglottitis in unvaccinated children. H. influenza type B Hib is a major cause, prevented by Hib vaccine. Why not? A. diphtheria causes pseudomembranous pharyngitis. C. parainfluenza causes croup, barking cough, steeple sign. D. S. pneumonia can cause otitis or meningitis, less commonly epiglottitis. E. EBV associated with mononucleosis, not epiglottitis. Treatment: ceftriaxone plus airway management, rifampin prophylaxis for close contacts. Bordetella pertussis, a 6-month-old infant, has a 2-week history of cough. Parents report episodes where she coughs violently and then gasps for air, followed by vomiting. She is afebrile. CBC shows marked lymphocytosis. Which of the following is most likely responsible for her symptoms? A. Mycoplasma pneumoniae, B. Streptococcus pyogenes, C. Bordetella pertussis, D. Haemophilus influenzae, E. Respiratory syncytial virus. Correct answer C. Bordetella pertussis. Explanation: whooping cough, paroxysmal cough plus inspiratory whoop, post-tussive vomiting. Lymphocytosis, due to pertussis toxin, impairs lymphocyte exit from blood. Why not? A. Mycoplasma, a typical pneumonia in older kids' teens. B. Strep pyogenes, causes pharyngitis. D. H. influenza, no whooping cough. E. RSV, common bronchiolitis in infants, wheezing. Treatment: macrolides azithromycin if early. DTIP vaccine prevents it. 3. Pastorella multicida. A 34-year-old man presents with a swollen, painful hand 12 hours after being bitten by his dog. He has erythema, warmth, and purulent discharge at the site. Wound culture grows a gram-negative Coccobacillus that is oxidase positive. What is the most likely organism? Eikenella corridens, B. Pastorella multicida, C. Staphylococcus aureus, D. Bacteroides fragilis, E. Pseudomonas aeruginosa. Correct answer B. Pastorella multicida. Explanation: dog or cat bites, Pastorella, rapid onset cellulitis, gram-negative Coccobacillus. Why not? A. Eikenella, seen in human bites. C. S. aureus, can co-infect but not typical of animal bites. D. Bacteroides, anaerobic, part of gut flora. E. Pseudomonas, seen in burns or water exposure. Treatment: amoxicillin clavulinate. Brucella. A veterinarian develops intermittent fever, malaise, and night sweats after assisting in a livestock birthing. Labs reveal hepatosplenomegaly and anemia. Blood cultures grow a gram-negative Coccobacillus. What is the most likely pathogen? A. Francisella tularensis, B. Leptospira interrogans, C. Coxiella burnetii, D. Brucella melitensis, E. Mycobacterium bovis. Correct answer: D. Brucella melitensis. Explanation: zoonotic infection transmitted via unpasteurized dairy or contact with infected animals. Causes undulant fever, hepatosplenomegaly, bone involvement. Why not? A. Francisella, transmitted via rabbits, causes ulcers. B. Leptospira, spirix seen in water exposure. C. Coxiella, Q fever, culture negative endocarditis. E. M. bovis, TB-like symptoms, usually in cattle handlers. Treatment: doxycycline rifampin, 6+ weeks. 5. Francisella tularensis. A 40-year-old rabbit hunter presents with fever and a painful ulcer on his hand. He also has tender axillary lymphadenopathy. Culture requires cysteine-enriched media. What is the most likely diagnosis? A. Anthrax, B. Cat scratch disease, C. Ulceroglandular tularemia, D. Plague, E. Cellulitis from MRSA. Correct answer: C. Ulceroglandular tularemia. Explanation: caused by Francisella tularensis, transmitted by ticks or rabbit exposure. Ulcers, regional lymphadenopathy equals ulceroglandular form. Why not? A. Anthrax, painless black eschar. B. Bartonella Hensley, lymphadenopathy, no ulcer. D. Plague, buboes, caused by Yersinia pestis. E. MRSA, no ulcer, or wildlife association. Streptomycin or gentamicin? Acinetobacter baumannii, a 65-year-old man in the ICU, develops pneumonia after 10 days of mechanical ventilation. Chest x-ray shows right lower lobe infiltrate. Sputum culture shows multidrug resistant, oxidase negative, non-fermenting gram-negative Coccobacilli. Which of the following organisms is the most likely cause of his pneumonia? A. Klebsiella pneumoniae. B. Acinetobacter baumannii. C. Pseudomonas aeruginosa. D. Haemophilus influenza. E. Enterobacter cloacae. Correct answer B. Acinetobacter baumannii. Explanation. Common cause of nosocomial pneumonia in ventilated patients. Multidrug resistant, non-lactose fermenter, gram-negative Coccobacillus. Why not? A. Klebsiella encapsulated but ferments lactose. C. Pseudomonas also causes VP but oxidase positive. D. H. influenza, not typical in ICU-acquired pneumonia. E. Enterobacter, ferments lactose, less likely. Treatment, carbapenims, e.g. meropenem or colistin for MDR strains. Would you like these compiled into a print